Morning, everybody. Welcome to the value of text messaging for underserved patient populations. I know living in the FQHC world, we all need to be nimble and flexible. So we've experienced a little bit of that starting last night that we had one of our speakers who had to unexpectedly drop out. So you've got, I am Mary Wiley-Pate from Care Message, a senior account executive there, and I'll also be co-presenting with Sarah Christensen. We're thrilled to be here. It's not often that we get to be in front of so many FQHCs, so we're pretty excited about the opportunity. We'll also have, as the bulk of our presentation, Steve Aberson, who is the COO at ChapCare, and we're thrilled to have him here. So let's kind of get started with just a couple of questions, and we're going to do this polling the old-fashioned way by you holding up your hands. I know we've got some people online as well. But when you're looking how you're communicating with your patients today, I imagine a lot of you are still doing phone calls, correct? If y'all could just raise your hand. This is the interactive part. And like any physical mail that's going out, are a lot of those coming back with insufficient address, perhaps? Okay. Any emailing still going on? Trying some of that? Okay. And a lot of things with patient portal. I agree. And then anyone doing text messaging today? That's awesome. I didn't know what the other might mean, but I think I probably covered them all pretty well. So really, you know, while the emphasis is really on improving health outcomes for the underserved, we really can't acknowledge that without really looking at that we have a pretty confusing payment system that's evolving. So as we're looking at some of the FQHCs that we work with, we see some of them that have made that shift to value-based care. Some of them are ahead of others, some are a little bit farther behind, kind of depends on the state. But kind of what comes with that shift, and even though we're seeing that about 50% of the payments now are going towards quality instead of fee-based service, it's still kind of, when you're looking at, I've never talked to an FQHC that they're over-resourced or overstaffed. So you still have to do a lot more with what you've got. I mean, you want to, your staff's being burned out from all the manual hours. I mean, it's all about how can I drive my no-show rates down? And as we really kind of work through that quadruple aim, that we can improve your patient health and the overall patient health and the provider experience. So when we kind of look at the traditional ways of communicating, even those are really challenging. I mean, when y'all are raising your hands, it's still all about pounding the phones. So we're seeing about 52% of those calls are really going unanswered. And with email, I think when you're really working with the underserved, it's kind of a barrier there, as they might not have access to the internet, much less a laptop. So we're not seeing a lot of success with email and seeing around a 19% open rate. Then in the patient portal, we're seeing about 63% of patients that really aren't using the portal, that we need to find more creative ways of maybe pushing a link of the portal to them instead of just offering them the link and expecting them to go out there independently. There's been a lot of studies about interactive text messaging, so it's that two-way text messaging that we think is really important. The top two studies, Care Message, we did on our own, so we're seeing about a 99% open rate. And of that, like the 82% of them are opening them within really the first 5 minutes. An external study has really kind of looked at text messaging in lower income and less educated populations as having like 2 to 4 times greater. We're finding that most of the underserved do have some type of cell phone. It might not be an iPhone, it might be a flip phone, but they are able to receive SMS messages. And so y'all are kind of talking about, you know, using text messaging, and what we're seeing in about 99% of the clients that we're calling on is that people have text messaging, but sometimes it's just a bolt-on to their EMR or their EHR. So how many are using text messaging off of your EMR or your EHR platform? Okay. And are you doing more than appointment reminders with that? Is it like outreach and maybe some other campaigns that you're doing as well? Or is it mostly appointment reminders? I can't see the poll. Okay. So we're really kind of looking at the value beyond appointment reminders. Our value is not exclusively in appointment reminders. We're really looking at how can we help you. Seeing at about 107 million is like an annual payment that HRSA does make out. But when we're looking at kind of the piece of the pie over here, that there are only 62% of the FQHCs that are receiving the Quality Improvement Awards, and I think that's a lot of people in this room. But then there's just 26% for the Access Enhancer for funds by increasing the total number of patients served by 5%. So we've worked a lot with our clients to really kind of understand kind of what your quality measures are, what it is you need to achieve. We have like calculators that we can use to kind of really help you improve those HEDIS and UDS measures. But there are a lot of things that we really need to consider when we're working with the underserved patients. I mean, there's challenges and obstacles that they have. There's social determinants of health, like language and literacy. When you're communicating with them, it's something that needs to be bilingual. And, really the way that we do that is that we don't use a Google Translator because we want it to be culturally relevant. So there's a difference in asking a woman if she's going into work or if she's going into labor. So something that makes sense and something that could really be at their literacy level. What we're doing, most of it's at a 6th grade reading level, some's at a 4th grade reading level. But then just kind of considering things that they don't have access to transportation or food or, networks that can support them. So I am going to turn it over to Steve so he can kind of go into how ChapCare is using Care Message.
Thank you, Mary. Hi, everyone. So I'm going to talk a little bit today about how our FQHC ChapCare is using Care Message to push forward patient outcomes, retention, et cetera. So I'm Steve Abramson. I'm the Chief Operations Officer at ChapCare. And so before I get into the nuts and bolts of everything, I'll just tell you a little bit about us. And so our mission is to provide excellent, comprehensive, and innovative healthcare services that are accessible to all the residents of the San Gabriel Valley. For those of you who don't know where the San Gabriel Valley is, that's in Los Angeles County in California. We have 8 health center locations, and we've grown significantly over the last few years as a result of the Affordable Care Act. So pre-ACA, we had 3 health centers. We now have 8. So we've grown significantly over the last few years, and the utilization of products like Care Message has been an integral part of that, and I'll talk a little more about that. Our current patient population is 16,500 annually, and through that growth, we have capacity to go up to about 22,000 unduplicated patients. Our EMR is Epic, and we get that through Ochin up in Oregon. And then just to give you some sense of what kinds of services we provide, we do medical and dental care, retail pharmacy, optometry, podiatry, behavioral health and substance use counseling. And we also have a grant through Covered California, the state exchange, in California to do health insurance enrollment, which will become a little bit more obvious why that's important as we get through the presentation. So that's a little bit about us. Now I just want to talk really briefly about the changing healthcare landscape, which I think Mary touched on a little bit before. Post-ACA, we're in a world of going from really maximization to optimization, meaning we've gone from an episodic care model, fee-for-service model, to a more value-based payment system, right? And so what do we need to do to really thrive in that environment, right? And it's really going, I think, from a passive to a more active approach. And so what have we done around that? Well, we adopted a patient engagement strategy so that way we can really become more active in how we engage with our patients on a day-to-day basis. And that means making sure they're coming in every year to retain them, making sure they're doing all of the gaps in care that they need to do, making sure we're educating them properly, right? And why is that important today? Well, one, it's important to help bend the cost curve, the healthcare cost curve. And the second thing really is just to really help us be successful in this new environment, especially as far as as our patient populations grow, as we provide more services, how can we be cost effective and still do all the things we need to do in order to manage our patients effectively? So what is a patient engagement strategy and what does ours look like? Patient engagement is just not communicating or educating your patients or implementing an online portal. It really goes a little bit deeper than that, and I have 3 bullet points here, and I'd actually like to start with the second one first, which is the culture of the agency has to prioritize and support this, right? And I think that goes for anything that you do within your, within your organizations, whether that be organizational culture or any other kind of, project you might implement. And it really starts with making it an intentional part of the agency culture on a day-to-day basis. And then what does that mean for our patients? Well, it means helping them develop the knowledge, skills, ability, and willingness to manage their own and their family members' health and care. And then it's also, and how do we participate in that? Using tools like Care Message, and then also making sure that our providers are working with our patients to design, manage, and achieve those positive health outcomes. So, quick poll, how many of you have defined your patient engagement strategy at your agencies? Okay. Sort of. Okay. So 5 key elements of a successful patient engagement strategy. Obviously, define your organization's vision for patient engagement, right? What I kind of mentioned earlier is create a culture of engagement and really making sure that that's first emphasized and then continuously re-emphasized so that it really becomes a part of the culture at the agency. You'll see bolded here, employ the right technology and services, and that's really what I think the meat of the presentation is going to be about today. Empower patients to become collaborators in their care, and then, as with anything else, chart progress and be ready to change and adapt as needed. So before I get into how we use Care Message and some of the use cases, just some considerations if you're going to choose a texting platform. Look at the vendor mission and track record of impact. See that the vendor is knowledgeable about the unique needs of the FQHC community and its patients. Products, ease of use and scalability. Broad coverage of use cases with pre-developed content library, and I can kind of talk about that a little bit more when we get into the education component. And then just transparent annual pricing with unlimited message versus per message pricing. And we selected Care Message. We've been on Care Message for about 5 years now, and they were an early adopter and leader in their field, and we were working with them for the last 5 years, and we're very happy with the product and continue to move in that direction. So. Quick poll. I think this is the last poll for my section. How many of you have evaluated text messaging platforms? It's about a third of the room, maybe. Okay. So I'm going to go into just a couple of the use cases that we have that I can talk about today and that we've used with Care Message. So first off is health insurance appointment reminders. This is utilized by our outreach department for health insurance enrollment and annual renewals. And I just want to give you a little context about how we do health insurance enrollment at our agency. When the Affordable Care Act came into being, as we were planning for that, we I think as everybody else, was not sure exactly what to expect. But what we did know was that there was going to be a huge rush of patients coming in, to get health insurance on which we'd probably never seen before. And so what we actually made the decision to do was really take the bulk of the health insurance enrollment responsibility away from our registration group in the health centers and actually place it with our outreach department. And we actually created locations outside of our facilities, what we call retail enrollment shops, which are what they sound like in a retail space, where people could come in and actually do covered California enrollments, Medi-Cal enrollments, et cetera. They can still do some of that within our 4 walls, but we kind of took the bulk of that out of the 4 walls of the health center. So just giving you some context there. Patient outreach. So using the group outreach function of Care Message supports patient throughput through management of our new member IPA list. So, we get that every month and making sure we're managing that effectively. Currently, about 80% of our assigned members have had a visit in the last 12 months. So I think we're doing fairly well in that area. Health education, so using the texting education programs for chronic disease patients, and I'll get a little bit more into what that is after. And then patient retention, using the group outreach used for clinical indicator reminders, so the gaps in care, and then also management of patients lost to care, so anybody who hasn't had a visit in the last year and making sure we re-engage them. And so overall, as you can see between these 4 use cases, we're really using Care Message to engage, assist staff to manage patients' health needs, and educate at all stages of the healthcare continuum. So just a brief timeline, and I won't spend too much time on this because I think the use cases are more important than kind of the order at which we implemented these things. But like I said, we started out with using Care Message back in 2014 in response to the Affordable Care Act and really making sure that we were able to manage all of the health insurance enrollment needs that we had at the time. As you can imagine, and I don't know, typically we find that to complete a health insurance enrollment for a state exchange plan through Covered California, or sometimes for Medi-Cal for that matter, oftentimes it may take 2 or 3 contacts with a consumer to make sure that that actually gets completed. Additionally, for the purposes of the state exchange, we actually don't get credit for an enrollment until somebody has actually made their first payment. So you're talking about typically potentially 3, sometimes 4 contacts to actually go through that whole process, right? So you can imagine if you have to have a live person make those phone calls every single time, and then you multiply that by thousands of people, that can get pretty labor intensive and costly. So we were able to use Care Message to do a lot of the reminders. And what we typically do, just so you know, there's 2 kinds of reminders you can send out. One's purely informational, and then what you can do is what's called, I like to call actionable, right? Which is, our records show that you have enrolled in a Covered California plan, but you have not made your first payment. If you'd like us to contact you today to assist you with that payment, please press 1, right? So that way we get a result back, and then we actually can follow up with them and complete that action, as opposed to it just being sort of a general message, and then we're waiting for a response. So just to give a little context there. Then in the 2015-16 period, we went into the health education space and started using the Care Message education programs, and we did that through a study with UC Berkeley, which I'll get into a little bit later. But what the education programs look like typically is they'll go for a certain duration, and the patient will get 2 to 3 text messages a week. Some of them are educational, some of them are inspirational, some of them are providing resources in the community that'll help support their care. And so that's what that sort of looks like. Then in the 2017-18 period, we went into using the outreach function, the outreach message function, which is really to fill in the gaps in care, which means, your patients that haven't had their colorectal cancer screening this year, or, their breast cancer screening, or their foot exam, or whatever that might be, messaging those patients to make sure that they come in and get those things done, right? And then lastly, and most recently, is appointment reminder integration with Epic, our EMR. And so the old process, and I'll get into a little bit more, was a single phone call 48 hours before the appointment. And now we have a much more extensive process, which is integrating the text message into that. So I'll talk a little bit more about that. So to get into each use case a little bit more specifically. So in 2014, we launched the text messaging platform, Care Message, and as I mentioned, our challenge at the time was to manage increasing volume of patient communication following the launch of the Affordable Care Act. And so the use case really was we launched the text messages to support the insurance enrollment process. So in 2014, we implemented this in advance of the second Covered California enrollment period, and that was really based off of what we saw in the first one. We've experienced a tremendous time and money savings through automation and kind of what I mentioned. And since then, we've reduced our uninsured rate from 28% to 21%, while increasing our overall patient volume during that time period. So we're very happy with that. In 2015, 2016, like I mentioned, we did the Type 2 Diabetes Health Education Program rollout. And so the goal of this really was to do a study and to test the efficacy of text messaging intervention for low-income patients with diabetes. And we actually worked with Care Message and a research team at University of California, Berkeley to produce this study. So in 2015-16, we began offering the 12-week diabetes education program that Care Message has built into their system at 2 of our health centers. I don't know how many education programs you guys have now. I think 19. So it's not just for diabetes. They have education for 19 different conditions. And the results were very promising. So one, we produced a clinically meaningful improvement in glycemic control. There was a 0.62 point reduction in A1C, with highly engaged patients experiencing a 2.23 point reduction. We actually did focus groups after the study was completed. And through those interviews with patients, it was real that the program provided both instrumental and emotional support. And I want to talk a little bit more about that really quickly. A lot of the patients that responded through the focus groups said that they felt really supported because they felt like they were getting the message on a continual basis, 2 to 3 times a week. And they really, that was really meaningful to them as they were trying to manage their condition. And then interviews with staff identified that implementation was facilitated by the ability to reach a large number of patients, making it feasible for a resource-limited community clinic. And what we learned from this study, actually, and we've used the education program in other areas since then, was we actually did physical enrollments in the facility when we did this, and we enrolled 50 patients into this. And that proved to be challenging from a resource perspective to just have, as you all know, the health center operations can be, everybody's a little time strapped and everybody feels like a lot of times that they have a lot to do. And so adding that additional piece was proved challenging. What we've done now as we've moved forward and, used these programs further on is we actually use an opt-out now. So anybody who's eligible, we'll send them basically a text messaging saying, you're eligible for this program. If you would not like to receive this, then opt out, basically. So we've kind of gone to that model, and that's proven more effective as a way to be able to do that. Starting in 2016, gaps in care. So our goal was to reduce gaps in care among our patients to ensure they're taking preventative measures to improve their health outcomes. And so what we did was we launched the automated outreach messages covering a variety of chronic diseases, as well as, like I had mentioned, patients that maybe haven't come in for a visit in the last year, those sorts of things as well. We typically now send out messages, a menu of messages once per month. And then, like I said, they're actionable. So we request response and then we do the follow-up calls. We'd like to be doing these every 2 weeks. And you have to just make sure when you're setting up these kinds of calendars that, again, your resources are aligned to be able to make the follow-up calls. Because when I say a menu of messages are going out, that means typically a couple thousand texts are going out in a given time for each message, whether it be, your foot exam, that could be going out to a couple hundred patients. And then you have, a cancer screening message that's going out to X amount of patients, right? So if we send out, say, 5 to 7 messages at a given time, it's probably going out to 2,000 patients, right? So you have to just make sure, based on whatever you see your % response rate is going to be, that you have enough resources to make sure that you can make those calls in a timely manner. And for us, that's typically within 48 hours. Otherwise, I think it sets a bad expectation for the patient. If they get a message, they're expecting to get a call back pretty quickly if they're asking for one. So just to keep that in mind. And just, this is just a snapshot of some results that we've had. So since January of 2016, which is really when we started rolling this out, we've had a 13.6% improvement in adult hypertensive patients whose blood pressure is in control. We've had a nearly 20% improvement in patients greater than 50 years old who've had a flu vaccine in the past year. 7.7% improvement in the number of patients 50 to 75 years with appropriate colorectal cancer screening. And we're actually going to be doing a study in the near future with Care Message in the University of Pennsylvania around that. That's going to be starting pretty soon. And then 6.5% improvement on the % of diabetic patients with a foot exam in the past year. And that's just a snapshot. We've had improvement in a lot of other areas as well, but that's just a quick snapshot of that. And then in 2019, the EHR integration with Epic. So, the big thing, I think we all struggle with this to some degree, is no-show rates. Trying to get that under control. We deployed appointment reminders through Epic in the Care Message integration in March of 2019. Just to give you some sense of how the process looks now as to what it used to look like. So like I had mentioned, the way the process used to work was that every patient would get a phone call 48 hours before their appointment trying to confirm, right? As we saw in Mary's earlier slides, a lot of people, don't respond to phone calls. Secondly, very labor intensive to have to call every patient that you have coming into your site every day, basically 48 hours in advance. So the way the process works now is this. 3 days before the patient's appointment, they will get a text message. Press 1 to confirm, press 2 if you're not going to confirm. Based off of that, right, you're going to get a certain amount of number ones. You take those people off the list, right? You're going to get a certain number of number twos. Those people have to be followed up with to reschedule. And then you're going to have a bunch of people that didn't respond, right? We take the people who didn't respond. We call those people 48 hours before, right? Give them a phone call, right? Try and confirm. And then on the last day, 24 hours before, everybody gets one final message, whether they confirmed or did not, just giving them one final reminder of their appointment. So instead of getting one reminder, they're actually getting 3 now, starting 72 hours out. Works for us. One, it gives us a little bit, not a lot, but a little bit earlier. If somebody's going to not confirm, we'll find it out a day earlier potentially, which again helps us fill slots. Again, giving us three reminders versus one also will help make sure more people are coming in. And so just to give you some sense, since we rolled it out, we've decreased our no-show rate from 17.83% down to 15.8%. So we're moving in the right direction. What we are still seeing, and we're going to do a little bit deeper dive into, is we have the data by health center. And so we're seeing still that certain health centers have higher no-show rates than others. And so we're probably going to do some surveys of those sites to try and get a sense of, if there's any other additional factors that are potentially affecting no-show rates at those locations. But so we are trending in the right direction there. So just to give you a sense also of just some other mobile systems that we're using. So we use a platform called PointCare. And it's a web-based application used for health insurance screening and enrollment. Also, you can create an individual health insurance record for each patient and consumer, and it has robust data reporting. So it's essentially, you can ask a patient 5 simple questions, and it'll spit out essentially what health insurance they're eligible for. And then, if they're interested in moving forward in the process, you can actually create what we like to call basically a health insurance record. So it's basically kind of similar what you'd imagine an electronic medical record is, but for health insurance, and it sits in its own platform. So like I said, our outreach department handles most of our health insurance enrollment, so they actually use this PointCare platform and create health insurance records within that to be able to facilitate that. Talking survey we use, and this is via tablets to do our patient satisfaction survey and mini surveys. We do the annual once a year, and then mini surveys as needed. And then Hitch Health, and this is another platform we're using to also help move our no-show rate. So this is also integrated with Epic through Ochin, and it's an automated process to make Lyft rides available to patients to attend their medical appointments. So the way that works essentially is there's an integration between Lyft and Epic through the Hitch Health integration that they've developed. And basically the way it works is you can set what criteria you want these rides to be offered. So for us, what we did was we took patients who had 3 or more no-shows in the previous year. So that's about 2,200 patients of ours. And every time one of those patients schedules an appointment, they will automatically get a text message offering them free transportation to their next appointment. And then all they have to do is say, yes, I want it, or no, and then just schedule the ride themselves. So it's very simple to use. So what's next for us? So one is expanding use of care message health education programs. So they've actually piloted with Ochin and Epic an integration. So we have the integration of the appointment reminders. They're actually have also just recently integrated the outreach programs as well as the education. That's been piloted. We're going to be actually rolling that out ourselves early in 2020. And once we do that, since it'll be integrated with our EMR, it'll give us much better use of being able to scale it up and also make sure, and I think this is a big thing, that our clinical team is aware of what patients are getting what programs, right? And that's a big thing. Utilize technology to receive more immediate patient feedback by having our service rated after each visit. So we're looking at platforms that we can potentially integrate into our sites. You see it around in all kinds of businesses now, where you receive a service and right then and there you can give some sort of feedback, whether it's rated 1 through 10. It's typically a kiosk or something like that. So we're looking at those kinds of platforms, especially as that relates to managing our online presence, as that's a huge thing for everybody nowadays. If somebody's unhappy with a service they received, they typically tend to go online now and post about it. So we want to make sure that we give people that opportunity to, provide feedback, and depending on how they rate us. Well, if you rated us great, okay, go online and tell people about it. If you rated us poorly, make sure that they understand what our patient grievance process is. So that way, we have a chance to respond to it before they may go online and want to tell the whole world about it. So that's that. And then lastly is expansion of current use cases via developed enhanced content for outreach messages, improvement of text language, et cetera. So there's a couple things we've been focusing on as it relates to the outreach messages, and this really is through the gaps of care that I was talking about. One is that when we send out outreach messages, we can put what's called a bit.ly into the message, which allows you to link to a flyer, a video, an audio recording, or anything like that. So if you think there's something that your patients really need education on, or as you're trying to get them to come in for something, you can say, our records show that you have not come in for X, Y, and Z. You can attach a bit.ly, then it'll have an educational video to it, and then please contact us if you'd like us to follow up, right, and press 1. So it gives you the ability to actually embed the education into the outreach messages, and just kind of looking at, how we can continue to improve in that area and put more content into those messages. And then the second thing is looking at just how the messages themselves are written and what people are responding to more, right? It's just as far as the language of the messages themselves. And that's going to be part of the UPenn study that we're going to be doing, is just looking at that and really just how the language affects response rate. And then just recommendations for FQHCs launching text messaging. One, include more clinical staff to increase standing of program. And I guess I just mean staff in general. This was a mistake we made when, or I wouldn't say it was made, just something we didn't know until we knew it, which was when we rolled out Care Message originally, you have to make sure it's a product like anything else, and you have to make sure you have enough staff to manage that product, right? And so, it sounds like, well, you just send out a bunch of messages, but there is mechanics behind that has to be put into place. And so for us, we actually implemented a member services department a couple of years ago. So we have a dedicated person who actually can be responsible for a lot of the activities that I described today. And now we have a support person beneath that as well. So just making sure that you have staff that can really own this. It doesn't have to be necessarily a person who manages this full time, but if you have a full-time person, maybe they can carve out 30% of their time or 40% of their time each week to really make sure all these things are happening. Otherwise, the product's only as good as what you really put into it. I say tailor the program or any program you're going to use to the patient's baseline knowledge. We're referencing diabetes here because we did the education program. That's really for any condition you might use it for. Future research, if you can, should assess the effect of the program in the patient population using a randomized trial design. So in your respective areas, if you do have a research institution there, it's great to pilot these things yourself and get results. But if you can actually put it into a study, that's publishable, that's even better. Enrollment and research for in-person versus automatic enrollment should be assessed. Like I said, we've kind of gone to an automatic enrollment model now. I think it probably depends on the resources of your agency, but for us, that's what's worked best. And then test strategies to encourage participation, e.g. positive reinforcement. And I think that's where I was mentioning that the integration between Epic and the health education and the outreach messages is going to prove key. Because then if the clinical team understands what education programs the patients are in, they can reinforce that when they come into the health centers, ask them how it's going, do they have any questions, and just sort of give them positive reinforcement that is a valuable thing and that it's great that they're doing that, right? So I think that is it for me. I'm going to pass it off to Sarah, and then we'll have Q&A at the end. Thank you.
Thank you so much, Steve, and we really appreciate you sharing your insights. ChapCare has been such a great partner with us, and mainly due to their feedback that they provide us. It's just been so helpful, great partnership. So good morning, everyone. My name is Sarah Christensen. I'm a senior account executive with Care Message, and we're happy to present today, although a bit unexpectedly. But I wanted to share that Care Message is actually a nonprofit, and so we share the mission that you guys have, and that is to impact the health of underserved patients. So when we were thinking yesterday about what to present, there's just so many clinics that we talk to that really are in the process of expanding their patient engagement solutions, or also expanding upon texting solutions. So we thought it would be really helpful to share what we've learned over the years in talking to other FQHCs, and really, what are you guys looking for? And what do you care about in a texting vendor? What questions should you be asking as you're evaluating your vendor? Because ideally, you want them to become a long-term partner, right? Not just a vendor. So will they work with you to achieve those goals? So the FQHC world is obviously very unique. It's a unique setting with unique needs. There's a lot of regulations, there's compliance. You guys obviously have minimal resources. And most importantly, you have very high need patients. Most of the clinics that I talk to have a significant percentage that are, if not close to all, that are at or below 200% poverty line. So very high need. As Mary Wiley mentioned, social determinants of health is a huge factor in them getting care. So when you're looking at vendors, one thing to really consider is, are they focused on the greater healthcare ecosystem, or do they specialize? So let's put this in medical terms. Why do we refer patients to specialists? Your general physician can understand some of their needs, but they're not going to have all the nuances. And the same goes with texting. So this leads to the next question, which is, when you're looking at vendors, do they have proven success with FQHCs? Do they have data points showing how they can drive impact for underserved patients? Are their customers similar to you? Ultimately, the question is, do they specialize? Another thing to really consider is integration. The integration between the texting platform and your EMR or your pop health tool, which is also a really important part of being able to reach out efficiently. These tools are obviously critically important to you, so it's really important that the integration works. So FQHCs, I think, are really realizing more than ever that bidirectional texting is mandatory for clinic efficiency. So does the vendor that you're looking at offer this? Another thing to consider is how much support and training is provided for that integration process. And a question we get a lot, which Steve talked about, is what resources will this require? What will it require during the implementation phase and the training phase? What will be required on an ongoing basis for sending these messages out? Who's going to handle that? And how many FTEs per week or per month is that going to require? Another thing that's really, really important, and Steve talked a little bit about as well, is having an internal champion, an internal influencer who can really focus on getting that adoption and having a plan for that adoption and working with a vendor who will really support that. So we can't have a discussion about choosing a vendor without probably the most important question of all. Anyone want to guess what that is? Yeah. How much does it cost? Yes, and ultimately that is an important part of picking a vendor. But what I want to talk about right now is really more about the structure of the pricing. And Steve talked about this a little bit. Many messaging platforms out there are priced based on how many messages you send out. And that can really be a shock, as I've heard from some clinics, when you get your invoice. So that's really not an incentive to engage regularly with your patients. So that's something to really consider when you're looking at texting vendors is, does the pricing model work for your needs and for what you're trying to accomplish? So customer support from your vendor is also really important. Is there ongoing support to reach your goals? Are they there to really help you succeed? Obviously, you want to hold the vendor accountable, but here's a comment you probably wouldn't expect, and that is, do they hold you accountable? And what I mean by that is, are they following up with you? Are they asking about your metrics? Do they understand your goals? It should be a team effort. So will they optimize your campaigns? And what I mean by that, are they adjusting your campaign on a regular basis for better response? Steve talked about that a little bit. Things that can be done are A/B testing, sending out 2 different messages at the same time and seeing what response rate those get. Adjusting the cadence of your appointment reminders, for example. Does 1 day work better than 2 days before? A week before? What does that look like? And then information about time of day. Does 10 a.m. work better or 4 p.m.? Also, tweaking the messaging on a regular basis to adjust and see how that impacts response. So that's really important to just be continually improving on that and trying to get the best response rate possible. Another question to ask is, what is the turnaround time for launching a campaign? As we've heard from many clinics, if you don't ask that question up front, there can be a really significant time for launching campaigns, and you want to be nimble and quick and get those campaigns out. Another question to ask is, what is the average time for response when you have a question or you have a request? What's the average time for resolution when you have a question or a request? So obviously, all organizations want to work with vendors that listen to their clients, right? That's important. But how does that manifest? How does a vendor prove that that's actually true in their case? Well, as the old saying goes, the proof is in the pudding. So I would encourage you to really look at product roadmaps, look at product development. Do the features that are currently offered or that are going to be rolled out, do they reflect your needs? Do they reflect your concerns, and will they address the needs of your patients? So ultimately, I think the goal is really to see a vendor as a true partner in your success, not just a vendor. So now let's talk just a little bit more about implementing texting. And Steve talked a little bit about this, but some things that can be done to make the process successful. It's very important to help patients with adopting texting solution by really just letting them know what's going on and giving them that option to opt out. Segmenting as much as possible. The more personalized the campaign is, the higher response. So there's a lot of ways to do that: demographics, quality measures, by chronic conditions, the preventive screening Steve was talking about. Our outreach campaigns can do that. Segmenting by specialty or department or providers. The more targeted the campaign, the higher your response rate is going to be. Another important thing is to ask patients regularly, how are you doing? How are you as a clinic doing? So I want to take a little poll here, and I promise this is the last poll of the day. How many of you are sending out doing surveys, first of all? Doing surveys at all? Most everyone in the room, okay. How many people are sending them out by mail? Couple. And then how many are sending out via text message? A couple. Okay. So that's important, to understand where you can improve, but I think another thing to understand is where you're doing things right. Because not only asking that question, I think it reinforces it with the patients, but those are great stories to share with your staff about the things that you're doing really well. So we're in a data-driven world. Data is king these days, right? So how can you pull out information you need? So this is something to ask of vendors that you're looking at. What type of reporting is available? What type of metrics? How does that data flow back into your EHR? And the goal with this is you want to have actionable insights that can drive improvement and impact, both in your clinic with clinical efficiencies and then with your patients. The goal here, right, is to improve the health of patients. So that's important. So in closing, I really hope this has just been helpful in thinking about some things as you guys are evaluating or maybe looking to improve texting. I think the most important takeaway that I want to leave with you is really thinking about, does the vendor understand your clinic? Do they understand your high-need patients? Do they understand your needs and your goals? And can they and will they work with you to create your unique path to success? And will they be there with you every step of the way supporting you?